Thank you for joining us for part 2 of this month's installment of Medoscopy as bariatric surgeon Dr. Jessica Cutler joins us in studio. Dr. Cutler, I want to read a list to you and you tell me its significance. Megalodon, Hastalis, Hemispristis, and cow. I know I'm slaughtering those names. That's not the 4 horsemen of the apocalypse, is it?
Not quite. No, those are actually 4 species of fossilized shark's teeth that you can find actually right here in the Chesapeake watershed.
And why are those of interest to you? You have an interest in sharks, am I correct?
I do, and fossil hunting too. I find it grounds me a little bit, to touch something that nobody's laid eyes on for 20 million years. It's humbling in a way.
I remember when I was a lot younger going out to Calvert Cliffs and gathering the little shark's teeth. And I wonder if there's any left after all those years of field trips, sending students out there to pick up shark's teeth.
There's a few, actually.
Still a few left?
That's close to where I go, so keep hunting.
When it comes to discovering shark's teeth, other than Calvert Cliffs, are there like special secret shark spots or places that you can go that most people don't know about?
There sure are, although a good fossil hunter never gives away their secrets. I would say beginners should consider checking out Flag Ponds, which is another public park in the Calvert area. It's a little bit easier of a walk than the cliffs.
So did you hope you would become like George and Seinfeld, a marine biologist at some point? Or?
That crossed my mind. I thought about veterinarian too, but ultimately I ended up really liking human medicine.
Isn't it true that it's really more education, schooling is involved to become a veterinarian than it does to become an MD?
They work really hard. It's very competitive to be a veterinarian. Ultimately I thought I would be too sad putting animals to sleep if it needed to be done, so ended up turning my attentions elsewhere.
Now, like our first guest, who was plastic surgeon Dr. Lauren Nigro, you're pretty new to the practice. You graduated in 2015 from the University of Pittsburgh School of Medicine. Are you originally from Pittsburgh?
No, actually, I'm a bit more local than that. I grew up in Montgomery County in Maryland.
So are you an Orioles fan or a Pirates fan?
I have a confession. I'm not a big baseball girl, but you'll find me in Caps gear.
Oh, really? Oh, well, Washington Capitals.
Washington Capitals.
Oh, well, you'll have to take some time to talk to Dr. Kevin Audlin, he and his family are huge Capitals fans.
So I hear.
Now, getting back to your field, how'd you end up in the field of bariatric surgery, weight management surgery? Is that something you always wanted to do, or?
No, so once I went to medical school, I actually started out wanting to be a psychiatrist, and once I got in the operating room, there was no getting me back out. I really like kind of that hands-on approach, touching things, fixing problems directly. But it took a bit for me to come around to bariatric surgery too, although after several years of working with surgical patients, the opportunity to give somebody a fresh start on their health, that's what really drew me in.
Another doctor told me once that he too wanted to start out as a psychiatrist, but he found that as a surgeon, he felt that he was sort of more hands-on on fixing a person's problem. You don't sort of have that sort of tangibility, I suppose, in becoming a psychiatrist or someone in the psych field. We see a lot of stories about bariatric surgery, weight loss surgery. We hear a lot of terms, gastric sleeve, gastric bypass. What's on the cutting edge now in terms of, what's the gold standard for weight loss surgery?
So I would say the most popular operation in the United States today is the sleeve gastrectomy. The Roux-en-Y gastric bypass is another very popular option. There's, endoscopic options popping up now. I think ultimately we are at a really exciting part in bariatric surgery where our surgeries are safer than ever before. Patients are getting home sooner. Some places are even starting to do same-day bariatric surgeries, and so I think that's ultimately perhaps where we're headed.
So becoming outpatient even?
Come in the morning, have your surgery, go home. I think once we get monitoring technologies to the point where we can still keep an eye on a patient from the comfort of their own home, that's when it'll be really safe to start doing that.
Now, one of the things I've heard that's challenging about bariatric surgery is it's not like if I was dealing with an orthopedic problem like a knee, I go in and get a knee replacement, I'm done. But if you're going through weight loss, there's a lot of pre-work that has to be done, and there's a lot of post-follow-up. Can you tell us a little bit about that?
Sure. So the process to get to bariatric surgery is somewhat determined by your insurance in terms of how long of a process they require you to go through. But certainly we want to make sure that our patients have enough education about what their diet is going to be like afterwards, what nutrition they're going to need to get, vitamins, that sort of thing. It takes a while to get all that information across. It's a lot to take in. And once they have surgery, we're not done with them. We like to see them back every year. We like to see how they're doing, make sure that their nutrition has been good and that they're on track with their weight loss goals, so that if they're having any problems, we can find out early, step in, and get them back on the right track.
From what I've seen, in the sense of community among people who are having weight loss issues, have had surgery, or are preparing for surgery is pretty strong. In fact, I believe the Maryland Bariatric Center has a Facebook page where people who have gone through the surgery or are preparing for it can talk to each other and give each other support.
Yeah, it's a really strong support group, actually. It's a secret group, so only available to our patients. But once in it, they have an opportunity to talk with each other, to talk with our dietitians, ask all kinds of questions, and we do a live seminar once a month on different topics about the weight loss world.
What do you think in the future, say if you could go into a time machine and jump forward 50 years, what do you think you would expect to see in your field?
50 years, I think we'll be down to one incision for a lot of our surgeries. I know there's companies out there right now working on the technology to do that, so I think 50 years ought to be enough time. Potentially even no incisions, although we'll have to see. I'm going to hedge my bets on that one.
We've seen some stories sometimes where people have the surgery, but they wind up gaining weight back. Why does that happen?
There's a number of reasons. Anatomy can change over time. Things can stretch a little bit. Depending on certain diet and lifestyle choices, weight can come back. But the good news is that we're coming up with more methods than ever before to help get patients back on the right road.
I've seen some studies recently where it talks about the positive effects of bariatric and weight loss surgery, where it may even eliminate someone's type 2 diabetes. What other sorts of positive benefits are there?
Sure. So diabetes is really one of the number one conditions that our surgeries are able to treat. High blood pressure, high cholesterol, sleep apnea, some other conditions related to insulin imbalance, so polycystic ovarian syndrome, diseases like that are all very amenable to treatment with bariatric surgery. There's recently some articles and information out suggesting a lower cancer risk in patients that have had weight loss surgery, and I think that's likely due to the inflammatory state that is induced by fat improving once the patient has lost some weight.
So when you're not doing that type of work in your ample leisure time, as I like to say, because doctors never really have any, but when you do, what do you like to do?
Well, I have a 2-year-old, so he dictates a lot of my time. When he's asleep, I love to do jigsaw puzzles, watch some TV. I play tennis.
Oh, really? Okay. How long have you been doing that?
I was actually captain of my tennis team in high school.
Oh, really? Where did you go to high school?
It's Montgomery Blair High School.
Oh, so you're still continuing that?
Yeah, I try.
It's interesting because I've talked to some doctors about things they used to do. There was an OBGYN here who in, I think it was 1984, was the saber fencer of the year at Johns Hopkins. And I asked him, why are you still fencing? And he said, no, I became a doctor. It takes up a lot of time, these sports and activities, but they're important, are they not?
It certainly is. I mean, being a doctor is a big part of my identity, but I think we need to save a little bit for ourselves too.
Dr. Cutler, one of the segments that we do on our show is a bit of a show and tell, where the physician will bring some item that's important to them in one way or another. Well, what have you brought to us today?
So you were asking about some of the shark's teeth. I actually brought a tooth from a megalodon shark. I found this one myself last winter. So it's probably between 6 and 20 million years old, believe it or not. And the sharks that grew this kind of tooth could grow to be about as big as a school bus.
Knowing what you know, how truthful was Jaws?
I've certainly never encountered any man-eating sharks in the bay, but 20 million years ago, who knows?
Thank you, Dr. Cutler. To both our guests, Drs. Nigro and Cutler, I'd like to thank you for your time and candor. I'm hoping our viewers enjoyed this chance to hear your stories, learn about an important topic, and learn a little thing or two about life, maybe. Thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. Until we gather again, may the road rise up to meet you. And thank you for sticking with us another minute or two for Wait, Doctor, I forgot to ask. This is the segment where we talk a little bit about questions patients, they just forgot to ask their doctor, or maybe it's something that your doctor wishes you were asking them. Dr. Cutler, what are your thoughts on this issue?
So speaking as a bariatric surgeon in particular, I wish more people would ask me, what's recovery like in the immediate days, weeks, months following surgery? I think 15, 20 years ago, the surgeries that I do were a very different animal than they are today. And I think some people would be surprised about how easy it is to get back to life after surgery.
That's interesting. I see more and more where surgery is less is more. In other words, it's easier, more things. You mentioned earlier about becoming outpatient. I've seen the same thing. In 2003, I had spine surgery. I had to be admitted. 13 years later, I had surgery again. Get off the gurney, go home. Same thing. So it keeps changing, it keeps advancing. And maybe if there's ways to sort of take the concern and fear out of the equation, people will be more likely to seek help. Do you think that's true?
I think so, for sure. Smaller cuts, better pain control, we're really making advances.
Fantastic. Thank you, Doctor.
Thank you.